Hi, I'm Dr. Bart Klika, Chief Research and Strategy Officer here at Prevent Child Abuse America. I'm here for another installment of a monthly research review. This is a second part of a two-part series on the topic of social norms. If you missed the last research review, which outlined the definitions and basic concepts related to social norms, please visit the blog on our website to get more information. Today, I'm going to be talking about some of the research that we've actually conducted here at Prevent Child Abuse America to examine social norms related to the topic of child abuse and neglect. So let's get started. In 2014 and 2015, Prevent Child Abuse America, in partnership with Dr. Jeff Linkenbach at the Montana Institute, conducted a couple national surveys to examine norms associated with child abuse and neglect. One of the unique things about this work was this was really one of our first attempts in the field, not only to understand something about actual norms, but to also get at some of those perceptions of norms, because as we learned during our last research review, that it's oftentimes perceptions of norms that really drive our behavior. And so in this survey, we asked a number of questions. The first was we asked about norms associated with the seriousness of the problem of child abuse and neglect. So we asked people the actual norm: child abuse and neglect is a serious problem. And then we asked about the perception of the norm. Most adults think that child abuse and neglect is a serious problem. And what we see here is we see that there's not a huge difference between the actual and the perceived norm. In the way that we interpret this data, we typically say that something is a norm if over 50% of people endorse that item. We also ask questions about the preventability of child abuse and neglect. And lo and behold, a large percentage of people hold the actual norm that child abuse and neglect is preventable, and they perceive that other people think that it's preventable as well. We asked about people taking action if they suspected child abuse and neglect. And so in this question, we asked people if they would take action if they suspected child abuse and neglect. And here we see not only did they endorse the fact that they would take action, but they also perceived that other people would take action as well. And then we asked a very similar question, but about should you take action if you suspected abuse and neglect. And again, we see a high percentage of people hold that norm and accurately perceive that other people hold that norm as well. We looked at some of these findings by different categories. We looked at these by age categories, by gender, whether by abuse status, so whether or not people had experienced abuse earlier in their life. We looked at some of the results by race and ethnicity, by region of the country, and by whether or not somebody was a parent. And our key findings, really, we didn't see large gaps between actual and perceived norms across these various groupings. We did see a few differences by gender, abuse status, race and ethnicity, and region of the country, but it didn't seem necessarily like a strong, consistent pattern. We did not find any significant differences, however, when we looked at whether or not people reported being a parent. The one thing that we did find was we did find some interesting results as it related to age. So when we asked these questions about the seriousness of the problem, we typically found that those who were 65 and older tended to have more pessimistic and less hopeful views about child abuse and neglect. So here we see that they're reporting the lowest scores on the seriousness of the problem, on the preventability of the problem. And when we see the issues related to whether or not they would take action, again, we see them reporting the lowest rates for that, as well as the lowest rates here on whether or not they should take action. So what are the implications of this? Some of the implications that we think of is if there truly are differences by age on some of the norms associated with these questions, we can think about targeting some of our messaging efforts potentially to some of those individuals who are over 65, and really to try to craft those targeted messages for those age categories. We also asked some questions in our surveys about Barriers to intervention. So this gets some at the bystander intervention and asks people what might get in the way of you intervening if you suspected child abuse and neglect. And we see about 2/3 of folks say because they were worried that they would make it worse for the child. About 1/3 of the people said, you know what, I was really afraid of my personal safety, or that would be a big barrier for me. But then about 1/3 of people said that they didn't know how to intervene. And to us, that's really our area for intervention. If people don't know what to do, we can help fill that gap for them. We were also curious about people responding by saying that it wasn't their responsibility to intervene. And lo and behold, we found only a very small percentage of people held that particular view. We also asked some questions about what people were doing to engage in any prevention activities. Only about 1/4 of the people responded and said that they engaged in any sort of prevention activities. But when we asked some more nuanced questions about doing things like donating to child and family serving organizations, about volunteering or providing mentorship, we see a large percentage of people are actually engaging in these behaviors. So what we need to do is we need to help people understand that you're already doing things that are actually helping with the prevention of child abuse and neglect. So from these results, we really see a message of hope, that people really find that child abuse and neglect is a serious problem, and they accurately perceive that others find it to be a serious and preventable problem. And when we look at some of the data that says, about 1/3 of the people said that they didn't know how to intervene in a potential case of child abuse and neglect, we have more work to do in thinking about how do we message what families, what individuals can do to really prevent child abuse. There's a number of areas that I think are ripe for additional work related to social norms, including engagement in home visiting services, that is, understanding some norms associated with why it is that people do or do not engage in voluntary services. I think there's some work that could be done related to social norms on the topic of corporal punishment, as well as the topic of bystander intervention. What are some of the social norms? We hear about cases in the media all the time of cases, public cases of child abuse and neglect, where abuse is happening in public. And I think we could do some more work to understand why is it that people do or do not intervene in these particular cases. I also know that we've got a number of chapters who are engaging in different types of social norms work, West Virginia, Nevada, and others. If you have any questions or I can be helpful in any way in some of your thoughts moving forward with social norms, please feel free to reach out to me. Email me at the contact information here on the screen. And if you have other suggestions or ideas for future research reviews, please don't hesitate to contact me. Have a great month, everyone.